Hello, folks. I hope everybody is here that needs to be here and that you can all hear me and my colleague Nicole, who will be presenting today. So I'm Shireen Ramprasad, and we'll introduce ourselves in a little bit, but you're here for our presentation on how embracing inclusive data supports a foundation for health equity and justice. So if you want to go to the next slide, Nicole. So today's presenters are myself, Shireen Ramprasad. My pronouns are she, her. I'm the Equity, Diversity, and Inclusion Manager for Services and Housing in the province, which is SHIP, otherwise known as SHIP. And we're located in Peel Region. But Nicole, my colleague, I'll let her introduce herself. We'll go into a little bit more about SHIP in just a few minutes. Go ahead, Nicole.
Good afternoon, everyone. Thank you, Shireen. My name is Nicole Abruscato, and I am the Manager of Central Intake and Access here at SHIP. And I also go by pronouns she, her, and it's lovely to be here this afternoon with you all.
So we're going to start today with our land acknowledgement, as we start all things whenever we do presentations. I'd like to acknowledge the land on which I have the privilege of living and working, which provides me space to play. Peel Region in Ontario is part of the Treaty Lands and Territory of the Mississaugas of the Credit. In particular, I acknowledge the territory of the Anishinaabe, Huron-Wendat, Haudenosaunee, Neutral, and Ojibwe Chippewa peoples, the land that is home to the Métis, and most recently the territory of the Mississaugas of the Credit First Nation. I'm grateful to have the opportunity to live on this land, and by doing so, I give my respect to its first inhabitants. I acknowledge the legacy of residential schools and colonialism continue to negatively impact Indigenous communities today. I commit to hearing the stories of this country's First Peoples, to educating myself about this country's history with First Nation, Inuit, and Métis people, and to incorporate my learning into my practice and principles. I seek a position of cultural humility in which I might engage meaningfully with First Nation, Inuit, and Métis colleagues in the interest of Indigenous clients and their families, caregivers, and communities. I encourage us all to put into action the 94 calls to action from the Truth and Reconciliation Commission of Canada by recognizing the attempted genocide of Indigenous peoples in Canada, which spans centuries. I recognize the privilege that I hold as a settler in this country. As such, I commit to heeding the call of the 94 calls to action through my advocacy, active voice, and action in my workplace, my community, and my everyday life. As a person of color, I'm honored to share space with Indigenous community in our commitment to dismantle racism and oppression for all equity-deserving peoples. We stand in solidarity and recognize that the calls to action help provide a solid framework for reconciliation for the injustices that have been carried out against Indigenous communities, including broken treaty relationships, the trauma of the residential schools, and the continued attempts by governments at all levels and religious groups to control the Indigenous family unit, resources, and access to services. We must never forget. N'oubliez jamais, miigwech. Thank you. Next slide, Nicole. So today's objectives for this presentation, we'll learn how to collect and apply inclusive data to allow equitable access to services. We'll introduce the HIA, the Health Equity Impact Assessment that we use at SHIP, and how to use this as an evaluation tool. And we'll bring it all together with some takeaways and some ideas on how to support implementation of these equitable practices. So now I'll turn it over to Nicole to get us started.
Thanks so much, Shireen. So I'll be talking a little bit about who SHIP is. And I always joke when we have these presentations, we have a lot of acronyms, so I'll make sure to spell those out. And I just feel like we have a lot of acronyms in the information referral sector as well. So who is SHIP for anyone that's not aware? We are a multi-service and nonprofit in Southern Ontario, Canada. Our catchment population is approximately 2.2 million people, which is larger than the whole state of New Mexico. 5.5% of Canada's population is where we serve, and we're about 14% of Ontario's population with the areas that we serve at SHIP. We are located mainly in our main office is in Peel Region in Mississauga, And then we also support in within Peel, so Brampton and Caledon, Etobicoke, Dufferin County, as well as Waterloo. And so we pulled some stats from the 211 Central Statistics in Peel Region from August 1st to the 31st. And in relation to what SHIP provides is mental health and addiction supports within supportive housing, as well as specialty interdisciplinary supports as well. And so in relation to information and referral, within Peel Region, there was 23% of the calls for housing and shelter needs, and 11% of those calls were for mental health needs. So really showcases the work that is happening in the community and the need for such services. So we've championed the fundamental right for housing for the last over 30 years now, and we're a nonprofit accredited organization with Accreditation Canada, our third cycle, and we do have exemplary standing. We've leveled up to hospital accreditation body, as we are a healthcare provider as well, and provide housing and health services and delivering it, as I said before, within Peel Region, County of Dufferin, West Toronto, and the region of Waterloo. And our purpose is we promote the well-being of vulnerable and at-risk populations and work closely with individuals within our community, enabling them to embrace their full potential. Our mission, so we work to support those with mental health and addiction challenges to increase their quality of life and to live their full potential through safe, affordable community housing and services. The top left picture is our main office, and the bottom picture is when we achieved our last accreditation cycle in November of 2023 as a celebration, which was a great celebration. A lot of hard work went into that, and it's always ongoing. But it was great to be a part of that cycle. Our vision at SHIP is quality housing, quality services, and quality lives. And we build that into all of the service delivery, but also within our staffing, people and culture, through our strategic planning, through our quality improvement plans, key performance indicators. We're always making sure our vision and mission is also intertwined into that. And also our values. And so another acronym here, excuse me, is CHIRP. So C for compassion, H is hope, I is inclusion, R is respect, and P for professionalism. And so it really helps to guide the work that we're doing, and especially within data equity. Our service model is unique, and we provide in-depth housing and service options. So really coming from that holistic point of view where a person is guiding the work and the service plans and care plans. The success of our model is that we offer a spectrum of integrated housing and services that address the well-being of our clients. So delivering a continuum of housing and services to support people based on their needs. So that person-guided navigation, and support with community wellness and integration, as well as housing and landlord engagement. So through our housing, we have coordinated access and rent supports, a continuum of housing options from emergency shelter, transitional housing, independent living, congregate living, and also 24/7 congregate living. It could be short term to long term, and it fluctuates based on the person's needs. The supports are also flexible and they're interdisciplinary wraparound services. And again, it could fluctuate of leveling up or stepping down services, and the focus is on mental health and harm reduction. Our community integration, we have a community development team who really focuses on the wellness of our clients in a food security model, employment and social recreation support. So we have a social purpose enterprise. If anyone's in the Lakeshore area, Port Credit, we do have a social purpose enterprise called the Social Coffee Bean. Lovely coffee, always put that in there. If you're ever in the area, come visit us. And then we also have a financial literacy support program, which supports individuals who may need that level up support regarding financial supports, and also trustee program as well wrapped into that. And then we also have tenancy and maintenance support. So really looking at eviction prevention, alternative dispute resolution, landlord engagement, and maintenance supports. Our central intake and access team is really the heart and the hub of the organization when people are looking to apply to any of our services in housing. Some programs like our shelters and emergency services, they apply directly to that program, but for everything else, it comes through our central intake and access team. And I see that there's two intake and assessment staff on this call today, which appreciate that you're here, Farah and Sandra. And so they work really hard to ensure that we are assessing individuals and meeting their needs at where they're at and encompassing their families, circle of care, gathering information, and really doing that service access and navigation piece. And so this team falls under our clinical mental health and wellness stream within the organization. And really looking at it from a clinical point of view, but again, that holistic point of view of an individual and the services that they need. So it is a streamlined process for accessing a continuum of supportive housing and specialty services for mental health and addictions at SHIP, and working collaboratively, like I said, with applicants and their families. And families is self-identified by the applicant, and they're all part of our welcoming philosophy within SHIP. There's also 3 short-term services that are connected under central intake and access, where we have an emergency diversion program, short-term case management, which is Instead, health and wellness, which is a partnership with Peel Living in providing short-term case management to tenants, and then landlord engagement specialists, that is a partnership with Peel Outreach and CMHA and Park. And like I said, our intake and assessment team, and many of them are certified community resource specialists with Inform Canada and USA. And so the main part of our presentation, just wanted to give you a little bit of background of who SHIP is. And so the next part of our presentation is really looking at collecting and implying inclusive data. And the real purpose of it for allowing that we have that equitable access to navigation and services, and really understanding the community that we're serving and who we aren't and why aren't we. So collecting demographic information, it matters. And so although our organization is funded by Ontario Health and then some regional programs as well, and there's mandates to collect the mental health and addictions provincial data set. However, SHIP has been collecting data since I first started at the organization, even before that. So I've been with the organization for about 16 years, and Shireen, I believe about 17 plus now. And so we've always collected the data and really looked at how can we leverage that to support our community and who's not at the table and the reason why they're not, and how do we include them, or look at leveraging partnerships to best support our community. So with collecting demographic information, it really helps the person to not have to repeat their story multiple times. They'll be better understood and supported as they receive a multitude of services within the mental health and addiction sector. I, for myself, know when I'm going to a new doctor or specialist, it can get quite frustrating having to tell my story over and over again. And so having this collection of data within our client record management system is really helpful for any service provider, direct service staff to really kind of understand the client story and then help to navigate or provide that service delivery. And we also have a standardized and streamlined data collection so everyone understands what they need to collect, the heartbeat of that collection timeline. And so that's really helpful on the reduction of documentation burden on frontline staff and within the organization. Enhancement of our data collection will support performance measurement, quality improvement, service planning, funding allocation, and accountability at our different various funding modules of provincial, regional, and local levels. And it'll also enable us to better collect and use our equity data when we're planning for outcomes and monitoring for priority populations. And so this has been really helpful to, again, look at who are we supporting, how can we ask questions in a truly authentic and inclusive manner that people will feel welcomed within SHIP and when they're receiving services or even asking about it and accessing us. And so when we may not have a data point or a data set, or we do have that data, again, that continuous quality improvement measure in how to best support folks. And we also, through this project that Shireen and I have been leading along with our colleague Sajin in Quality Assurance Department, have been able to come up with a dashboard to better see and showcase our data that we're collecting so that we have a one-stop shop in a visual manner of the data and how we're best supporting our community and maybe where there's some challenges or barriers. All health records are secure and protected, and there will also be consistency and alignment with other provincial data and digital initiatives or the digital health initiative that's happening right now in Ontario, and it will align ourselves to that in the Ontario health teams. And so the mandatory information in dashboard, we created this through Power BI. Well, Sajin did because I would have no idea how to use Power BI or create that. So we had a common data set before with our funders, and so it only collect a certain amount of information. And so we created a dashboard at that time to make sure that we were collecting all of the information that was needed. With the new provincial data set that came out, this is all of the areas that are mandatory to collect. However, we were collecting some of this information before as well. And they're just grouped for a visual purpose, just because a long list of the data sets might not be as easy to read. So we've just grouped it here. So the different PDS areas that we're looking at is the date of birth, birth sex, gender identity, sexual orientation, country of birth, citizenship status, year of arrival, pre-existing condition or conditions, veterinary status, highest level of education, employment status, income source, total income, household income, relationship status, number of people the income supports, residence type, legal status, indigenous status, primary and additional ethnicities, religion, language, preferred language of service delivery, preferred official language, English or French, and Francophone status. And so all of these areas are really crucial to our service delivery in really ensuring that we understand the populations that we're serving and can align ourselves with them so that they feel welcomed and included in our organization. So with our CDS information, these were the 8 areas that we were required to report on and collect the data. And so when we first started looking at our data and making sure that we were in alignment, we originally called it a compliance rate. Were we in compliance of getting our demographic information? And so through conversations within our project team, Shireen really highlighted the importance of looking at it as, are we aligned with the individuals that we're supporting happening in the community. And so we changed it to an alignment rate and really looking at it from that holistic person-guided lens. And so when we first started the project of looking at a dashboard with all of our information, because before it would pull up in an Excel document, it was overwhelming. This was more of a visual, and I myself can really contextualize when it's a visual descriptor. We were at 54% alignment rate of our demographic information. And so once we started training staff on the importance of collecting information, how to collect the information, how to ask questions, within 6 months of using this dashboard and our training, we were able to increase our alignment rate to almost 92% within 6 months, which was a fantastic achievement for the organization in a short period of time, and really showcasing the hard work of staff who are aligning themselves with what is needed, but also showcasing how to best support our community. And so now with the new provincial data set, we needed to update our dashboard. And so our quality data management analyst, Sajin, often refers to this as the watermelon page because it looks like a bunch of watermelons. But essentially, it's showcasing green is who we have the information collected and we've aligned it, and red showing as the information has not been collected or may have an old CDS data element intertwined into the client's record. And so this is our current dashboard, and we're retraining staff with all of the different elements that we now need to collect the data for to ensure that we're aligned with Ontario Health, but also, again, showcasing who is accessing our services and how we can best support them. And so when we first started this, the new PDS, we were at about 54% again. And just recently, I checked it this morning, we're at 75%. So we've just started training folks, I believe, in early August. And so we've seen an increase from early August to now of almost 20%, which is fantastic, and really showcasing the need for that continuity of the reason why we're collecting this information, the importance of it, and then having a dashboard that's visual for everyone in the organization. So managers have the access to this where it showcases, you can select certain programs, you can see all of SHIP, and then we have a breakdown for each staff member so they can see their own caseload. And then we have a client demographic page as well, where we're able to see within each data element, so gender identity, we can see this, the specifications of those aligned data sets. So really great visual tool to help us keep us accountable to the information that we need to collect, but more so the real importance of why we're collecting that. And Shireen will go into more detail of that and can do it more eloquently for this, and it really showcases why we need to have that EDI or equity, diversity, and inclusion lens, as well as health equity and a justice lens to why we collect this information. So I'm going to turn it over to Shireen now. Thanks so much.
Thanks, Nicole. We're very proud of our dashboard and the progress that we've made as an organization in building a culture of data equity, really recognizing that we collect a lot of information from our clients, from the community, and from their families. And so we have to be responsible with the information that we're collecting. So one of the ways, and I'm going to talk a little bit about one of the tools that we use at SHIP as a health service provider. As a health service provider, SHIP recognizes the need for all of our programs and services to follow a health equity framework. Health equity really is about looking at the whole person, understanding that people's health is not only about their biology. It's not just a medical question and medical issues or physical health issues that we need to be aware of. When we are looking at a whole person, we're looking at all of the factors that impact that person and therefore impact their health on a whole. And factors like those include their social conditions, their economic conditions, the environmental conditions, the health behaviors for sure, as well as injury and mortality. So when we're looking at whole people, it really gives us a perspective of why we collect the data that we collect. And as you saw that Nicole explained, we do collect a lot of information. And though as an organization we are required to, because we are health funded, it doesn't mean that that's where we stop. The responsibility is really around what we do with that information to benefit the clients. So even if you're not a health service provider and you don't provide health services, any of the systems in which you operate and that work and operate on people have inherent inequities built into them. All of our systems are products of colonization. And so we have to keep that in mind. As such, each of our organizations can benefit from understanding how a framework like this, an equity framework, so you can substitute health with whatever system you operate within, and the principles it represents can enable you to improve access by focusing on the conditions that impact the people that you serve. Next slide, please. So I know there's a bit of a delay, but there's a diagram that will come up just now for you all. And I like to use this diagram to kind of show a little bit of how we move by using things like the health equity framework and the data equity principles that we've adopted at SHIP, this project that we've undertaken around data equity and the collection of inclusive data, how you move from an inequitable or inequality to really seeking justice for communities, clients, and family members. So we'll see, and I like this diagram because it takes me back to my childhood. Many of us may have had read to us or have read The Giving Tree. So this is representative of that book that many of us have read. And I think it's still around because I think I read it to my son at some point as well. But it really does exemplify how you move from inequality to justice. So in the first picture, what you see is that the tree is leaning to one side, there are more apples on one side. So the person on the left really does have the ability and the access to the majority of apples and the way that the apples are falling. So that's inequality. When you look at equality, and sometimes this is where most of us try to build equality into the system, where we give people the same thing so that they can then, we treat people the same. So we give them the same thing so that they can have access to services, or in this case, access to the apples. But what we see with equality is that even though we've given people the same thing, so we've been fair, the person on the right still is not able to access the tree and the apples. So even though we have made an attempt and we've tried to be equal, equality is just not enough sometimes. So our goal is to move towards equity. What equity means is that you are giving people what they need. So you are providing equitable access. You're making sure that your services, your intake procedures, your application forms, for example, your service details, provide people what they need. And so you might have to change certain things in order to be equitable to each individual or to each individual group. So equity really is about providing what people need in order for them to have a fairer playing field and be able to access your services based on their unique individual needs. And so you see in the diagram, we've given the person on the right a taller ladder so that they can reach the apples on that side. But what do you notice? Even though we've given people what they need and there is access there, the tree still leans towards the left. There are still more apples available to the person on the left. So what we really ultimately are striving to achieve in our services and for people is to build justice, is to seek justice in our policies and practices. Justice means that people are given what they need according to their needs, but what we really need to do is fix the system that created the inequities to begin with. And how do we do that? By identifying what it is that the inequities are that are ingrained in our systems. So when you do that, you are able to then fix the system. So we fix the tree in this diagram instead of having to fix the people or the processes that are operating on them. When you fix the trees, so when we fix our systems, we fix our programs, our policies, our processes, we no longer have to be able to look at what it is that you need to provide to each individual, because we're already providing it without anybody having to ask for anything different or special or anything like that. You fix the inequities first, and therefore you have services that are just. And that is their ultimate goal. Many of us are in this phase of equity, trying to build equity and get to justice eventually. One of the reasons that we do this talk is really around how do you then use your data to build equity into your processes with the ultimate goal of justice. Next slide, please. So one of the ways in which we do that, and what the HIA, the Health Equity Impact Assessment, does, is it points you in the direction of looking intentionally and meaningfully at what we call the social determinants of health. One of the tools that we use to look at those inequities is within our systems are looking at the social determinants of health in a profound way. As you can see from this list, and it's not exhaustive, this is a list from, I think, Public Health Services Ontario, but it is not an exhaustive list because people are way more than just these things. The social determinants of health are the things that operate across that spectrum that I talked about when I talked about the health equity framework. Across that spectrum, there are things that are operating on your life. The social determinants can be applied to more than just health disparities. These are the functional properties of our lives as human beings. So it's not just about health. So you can take the word health and build it and use something else in there. You know, the social determinants of well-being, the social determinants of wellness can be said as well. Building equity requires looking concretely at where inequities are inherent in the system. So we look at inequities within the education and literacy systems, within the early childhood education system. We look at inequity within our social supports and our recreational systems, inequities that exist within employment and social status. You could likely substitute the word health here with access and or quality of life. The importance of what determines whether some have better outcomes than others, what impacts these outcomes, and why they must be considered when creating spaces, access, and programs. So I always try to sort of focus people on looking at a whole person, and as I talked about before, and the social determinants of health help us to do that. So much of the data points that Nicole mentioned in our PDS, they are the social determinants of health. So what we are collecting, the information that we are collecting from people are the social determinants of health. So the link that we need to make then is when we get this information and this data from people, how do they connect back to their health outcomes? And how can we ensure that our services are designed in order to improve the health outcomes when folks tell us about their experiences and give us their data? Next slide, please. So we have a short video just to kind of outline a little bit about the social determinants of health. But I do want to stress again that you can substitute that word health, because I know not all of us on the call are within the healthcare system. But you can certainly substitute the word health with quality of life. Like I said before, access. Many of us are here from access services. So you want to play the video, Nicole? And I know there's a delay, so It may take a little bit.
Even before we're born, there are factors at play which influence our health and well-being. The conditions in which we're born, grow, and live can affect us and our health in different ways. We also react to them in different ways. Poverty, stress, lack of adequate housing, education, unemployment, and poor access to transport and nutritious food are some of the things that can affect our health and life expectancy. The World Health Organization recognizes that health and well-being are strongly influenced by social, economic, and environmental factors known as the social determinants of health. The environments in which we are born, grow, live, work, and age can have stronger influences on our health than our genetic family history or behavioral risk factors. A person's social and economic circumstances affect their health throughout their life. The relationship between income and health is on a gradient. This social gradient means that even a little bit of wealth can increase your likelihood of being healthier. A stable source of healthy food, appropriate, affordable, and secure housing, education and employment, relief from financial distress, access to transport and services, loving and stable relationships, and being able to make choices about our lives means we are less likely to experience chronic conditions such as diabetes, cardiovascular disease, depression, anxiety, and other mental illness. How we are treated by and interact with others also has a huge impact. Stressful circumstances over a long time that make people feel anxious or unable to cope, discrimination, racism, social isolation, or just being treated as less than equal can lead to poor health. And the interplay between these factors and a person's socio-economic circumstances can compound the situation. Experiencing a lot of stress and feeling unable to change things can also lead to poor health. But as health clinicians, there are things that we can do to make a difference. Look beyond the illness to see the whole person and try to understand the reality of their daily situation. Ask them what they think would make a difference to their lives and really listen. It may be that taking care of their health in the way you suggest won't be easy. It may make things more stressful for them. So try and see what other support you can offer. Advocate with them and give them knowledge on where to turn for help. Offer transport options for people to come to your service. Consider food vouchers to families who are struggling, or talking to nutritionists who can work with people to cook a healthy meal on limited income. Offer education about making better lifestyle choices to encourage healthy eating. But remember that all the advice on good nutrition will be a challenge if people are living on a limited budget. Offer medications for longer periods of time for people who can't get to a pharmacy easily, and refer people to other services like counselling or housing assistance. Help improve their health literacy by encouraging and working with them to better understand their illness and be more active in their own health care. Even one small action, like really listening and being compassionate, can go a long way to improving their health. Changing your practice, even ever so slightly, might mean the world of difference to someone.
I think it's still playing for them. As you can see from the video, and I just gave it a second because I know there's a bit of a delay. As you can see from the video, data is powerful. The social determinants of health, which is a lot of the data and the information that we are seeking from clients at the outset, is very powerful and can have an impact on the services that you provide access to clients with, right? So it can really indicate for you as navigators of the system how to direct clients to the most appropriate services that are going to be able to benefit them the most. And that's ultimately how we seek justice for clients, to reduce those inequities by providing them the opportunities and the access to the services that they actually need. So one of the tools that we use to try to do this and build equity into our practices and how we provide services to clients, but also how we identify what it is that clients actually need and what our impact is through our services, is called the Health Equity Assessment Tool, or we affectionately use the acronym, the HIA, just because it's easier to say. At SHIP, we conduct the HIA on all of our programs to generate health equity work plans. So each of our programs goes through this process with a facilitator like myself of doing the HIA assessment so that they can take a really intentional look at what inequities may potentially be ingrained into the program and services that they provide, and how we can mitigate those inequities and maybe potentially change some of the things that we're doing to better serve the folks within those programs. So they set concrete goals when we do the health equity impact assessment. It helps us to align our services, policies, or programs with the need, enabling for better health outcomes. It's a structured method, so it's a standardized assessment tool to include equity in health planning and decision making. And it's a practical tool as well. So you actually go through a process, and I'll show you in a little bit what that looks like. It helps us to anticipate, and so there's that prevention piece as well. If you're able to anticipate and identify things that you are potentially doing that are impacting folks negatively, you're able to anticipate for future programming needs and development, so that you develop programs and hopefully co-design programs and practices that are not, that don't have those inequities built in. So we're looking at unintended health impacts that a plan, a policy, or program might have on vulnerable or marginalized people within the population. It helps us to also build on existing work and creates greater transparency and consistency in the way that equity is considered across the system. And the end goal of the HIA is to achieve health equity and eliminate disparities in health through action. So that's the other important piece. The HIA is a health equity impact assessment. So we're looking at our impact, and then we're developing a strategy to action any of those negative impacts that we might be having on folks. Next slide, Nicole. There are 5 steps of the HIA. As I said, it is a standardized assessment tool, so it does take you through a bit of a process that has been developed by the creators of the HIA. So the 5 steps of the HIA are scoping, then looking at impacts, both positive and negative, unintended impacts. So the HIA really directs you to not just look at what you're currently doing and the impact that you currently have, but we're looking at what are the unintended impacts, the things that we're doing that we didn't mean to necessarily do. We didn't mean to necessarily have our service provision have unintended negative or positive impacts on people, but we're doing it and we're noticing that that's what's happening anyways. So it forces you to kind of pay attention to those unintended things that are having an impact on clients and families, and therefore on community, that we didn't really mean to happen. Both positive and negative is what I said. So the positive unintended impacts really points us in the direction to keep doing things and build on those things as much as we can. And then the negative unintended impacts makes us look at how do we change what we're doing to better support people in the way that they need that support. And then the next step of the HIA is mitigation. So in this part of the HIA, what you're doing is developing mitigation strategies on how to increase and improve the positive impacts that you're having, and then how to decrease the inequities that you identified in that negative unintended impact stage. And then you go on to monitoring. So here again is how we are evaluating what we're doing, and we're looking at whether or not our methods and our mitigation strategy are working? Are they effective? Do we need to adapt and change them? And then the final stage is dissemination. And this is where that accountability piece is built into the tool. Dissemination is about how are we sharing or reporting our progress or our challenges. Who are we sharing it with? And how are we getting feedback about what we have been doing? So it really also builds into the tool the idea that accountability is vitally important. Whenever you're trying to make a change and improve a service, a program, a policy, you really do need to hold yourselves accountable as an organization. And that means holding yourselves accountable to those who are most impacted by the change. So this dissemination phase really points you in that direction of going back to your clients, the service recipients, applicants, whoever it may be, who are most impacted by the change that you have put in place, and hear from them whether or not the change has had the intended benefit that we created it for. Next slide, please. So I'm going to go through a little bit. This is the template that the HIA what the HIA looks like. It provides that standardized process, like I said, following the 5 steps to help programs identify disparities and then develop a strategy to address the identified inequities. What we do in the scoping is that we're looking at, as a team, and I usually do the HIA with teams, with programs. And so in that scoping phase, what we're looking at is what are the groups most impacted within that program that we are intending to change something for or to reduce an inequity for, that we want to be able to address something that is creating a barrier within our system or within our program for. This year, our HIAs that we did this year are focused on equity deserving groups as defined by the Ontario Human Rights Code. We focused on the social determinants of housing, income supports, social networks, and access. Each program identified unintended positive and negative impacts of their service in these areas, and then we worked together to develop steps to mitigate the impacts and how to measure that progress. The common theme across many of our programs was the use of assessment tools that are not culturally adapted to meet the needs of equity deserving populations or recognize the impact of intersections. The mitigation strategy that we are undertaking is a review of those tools and by those who are most impacted and implementing their recommendations. So this is how you can use a tool like the HIA. Although it is, particular to healthcare, there are a lot of equity tools out there that help you to build equity into practice and evaluate your systems, your practices, your programs, your delivery, your access model with an equity lens. This is just one example of one of the tools that we use at SHIP to do that. And so now I'm going to give you a couple other examples of how you can build equity into your organization and into your practices and policies. So one of the things that we've been talking mainly about service provision and building equity for clients and for client care and for, developing access models that are equitable. But we also need to recognize that equity is about the whole organization. As an organization, as a healthcare provider, yes, our focus is on providing equitable services. But in order to do that, we also have to have a culture of equity within the organization. Those that are providing the services also have to feel that they are being treated equitably, that they work in an environment and have an organization that is equity focused for them as well. And so one of the things we focused on intentionally in the organization is improving access within our own organization as well. So we've taken several measures. We asked, so we received feedback. We've done focus groups. We've talked to our staff. We've had surveys. We've done a number of different things. And we listened. We actually listened and heard what staff were saying about their ability to bring their authentic self to work, to feel a sense of belonging, and whether or not they felt that accessibility was a priority for this organization. And then we implemented. So there have been several things that have benefited from going through this process with an equity lens. We have an accessibility plan that was developed and recommendations that were made through a third party. We hired a third party organization to do an accessibility audit on the recommendation of our employee resource group. So our ERG Abilities, which is an employee resource group, so we have 6 of them at SHIP, which have been extremely beneficial, made the recommendation to do an accessibility audit. And we did that. And we received back a 30-page report of all of the things that we could do to improve accessibility at SHIP. And we are very proud to say that we listened and we have been implementing. We have taken all of those 30 recommendations and we have put them into an accessibility plan and work plan that we have been working through and building accessibility into our organization. Our plan is on our website for folks to be able to see and once again hold ourselves accountable. We've also taken a look at a lot of our materials that are available to staff as well as to clients, families, and community. So you'll see on the right, that is our essential intake and access pamphlet that we had reviewed, and we used a tool, which I'll talk about in a second, to review the tool, to review our materials and ensure that they're accessible and that they are inclusive in our language, in our view, and ensuring that folks have the best possible and the simplest and easiest way to access our services. So we have our commitment statement there that we're committed to supporting accessibility. Individual accommodations are available upon request. And that is on as much of our material as we possibly can put that on so that folks know that if you do need an accommodation or if you need something different than how we have provided it to you, you can let us know and we'll work with you to figure that out. Next slide, please. So I did promise that I would talk a little bit about the other tools that we use and how we build equity into our policies and practices. And so one of the things that we have done in the organization is we have an EDI committee, so an Equity, Diversity, and Inclusion Committee. And that committee helped develop an equity assessment tool. And this tool is used to review all policies and processes. And when new policies are being created or processes are being created, we use this tool at the very beginning. The tool provides steps to build equitable principles into the policy. So for example, and you'll see this is just a snapshot of the first page of the tool. Step 1 is to identify those impacted by the policy, process, program, and how they are potentially impacted. It guides you through who should be consulted or at the table in creating the policy based on this impact and inclusive representation. The tool identifies areas to assess, including using an equity lens with an intersectional approach, inclusivity in the scope of the policy or procedure, legislation compliance, whatever relevant legislation, and always directs you to human rights code. Every policy within an organization and every program within an organization should be adhering to the Ontario Human Rights Code. And so really that reflection is of what we are doing violating people's human rights is really important. So this tool kind of gives you that basic foundation and points you in that direction. It also gives you some guidance around the use of inclusive language with some pointers around inclusive language use. And then part of the tool as well is alignment with our values as an organization. So it has within it a reminder of SHIP's values, and it asks you to ask yourself if this policy, procedure, or program development is aligned with SHIP's values of CHIRP. So that's part of one of the ways in which we have developed a tool that helps us to build equity consistently across our policies and procedures and programming, that everybody can do. It gives you guidance. So you don't have to have any special knowledge base to be able to use a tool like this. And we use it across the board. And we try to ensure that people have access to whatever they need in order to be able to take an equity approach when they are developing a group, developing a program. If they're changing something within their system already, we want people to be able to use this tool. Okay, so I'm going to pass it to Nicole. I've spoken enough, and Nicole will take us through some implementation tips.
And I'll go over it quickly just because I see a really great question in our chat and if there's any other questions. So an overview, and thank you so much for that, Shireen. Like I said, you can speak to it so well and really appreciate all your efforts in with this project and the importance of it. So with our implementation, as Shireen talked about, we did a review of all of our intake assessment tools, our letters that we send out, admission forms, and other relevant documentation. And it went through our Equity, Diversity, and Inclusion Committee, our Internal Intake Committee, our Intake and Assessment Team, our Client and Family Program Advisory, as well as some of our ERGs as well. And then utilize the Equity Assessment Tool in making those recommendations and build an equity lens into our current practices. And then also referring to client demographic data and the HIA when we're creating or updating policies and procedures so that it informs that practice and we can really look at the longevity and cross-reference it with any of our values, with our mission, our vision, as well as our KPIs, our QIPs, and our strategic plan. And so takeaways, you want to ensure that you have representation at the table for decision making around changes for informed approach. So we often talk about nothing about them without them. So ensuring that we have everyone at the table that needs to be there. And if they're not, why and how can we support looking at aligning ourselves with our community. We're building in the client voice wherever possible, as well as families, and develop and build sound data collection processes, referring to our data to ensure changes are evidence-based and taking the time to build this foundation and the pieces with using inclusive tools. And always remembering an equitable approach requires intentional, meaningful action informed by those most impacted. So that's the end of our presentation. We have our contact information here. We're going to be uploading a PDF version of our slide deck to this platform. So it'll be available after this presentation. And so there was a question in the chat by Krista. So thank you so much, talking about employment status and looking at volunteer status. So part of the employment status drop down through the provincial data set has an indicator for volunteer. So it has different areas of like paid employment or casual work, full-time work, but it also has the indicator for volunteer status as well, which is really helpful in knowing if that is an area that someone would like support with or is currently active in, as we also have a community development team that we look at volunteers and really value their time within the organization, but also identifying that in their record management system as well. So hopefully that helps to support with that question, but a really great one. So thank you so much.
Yes, thank you, Nicole, and thank you, Shireen. It was very informative. I'm glad you're going to upload the presentation because I would like to go through that again. That's a lot of work that you guys have been doing, and it's some great work that has been done. So thank you for everything you do.
Thank you.
Thank you.
So there was just that one question in the chat. Nothing else has come through. So it looks like you did a good job presenting. And thank you very much for joining us today. And for all the attendees, thank you for joining us, and we'll see you at the next session. I believe at 1:45. Take care, everyone.
Thank you, everyone.
Thank you. Take care.